Hi everyone, my name is Rachel, and today we will be talking about a couple different cases and going over some questions about these patients' diagnoses. So the first one is a 16-year-old female is recently diagnosed with a deficiency of muscle glycogen phosphorylase. She and her family are concerned and ask a couple questions about her condition and things that they need to be aware of. So the first one is they're not fully understanding the issue, and can you explain how muscle glycogen is used normally during exercise? So muscle glycogen produces the primary energy source for the muscles to maintain contractions during exercise. Most glycogen is stored either in the liver or the muscles. Hepatic glycogen helps maintain the blood glucose levels, while muscle glycogen breaks down to allow those contractions. Glycogenolysis is what we call the pathway by which that glycogen is broken down into glucose into the bloodstream. This process begins with an enzyme called glycogen phosphorylase, and that is the enzyme that she unfortunately is deficient in. And this catalyzes the release of glucose from the ends of those glycogen branches. So ATP is the name of the usable form of energy that the body needs in order to produce muscle contractions. And that ATP is produced by the oxidation of that glucose in the bloodstream that comes from those intramuscular glycogen stores. The next question is, she really likes to take long walks with her friends, and she wants to be able to know if she is still going to be able to do that with this condition. So the rate of glycogen depletion during exercise is directly related to the intensity of the exercise. So during exercise at least 60% of maximum intensity, which is essentially what we call VO2 max, which is the rate of oxygen uptake at maximum intensity. Muscle glycogen is the primary fuel oxidized to produce that ATP. At lower intensities, free fatty acids from intramuscular triglyceride stores are also oxidized into ATP. So you'll be able to continue that lower intensity exercise, such as walking. However, higher intensity exercise may be very difficult, especially after more than just a couple minutes. That low to moderate intensity exercise may actually be really beneficial to people with this condition because it allows you to essentially get the most out of your limited ability to use glycogen by depleting it much slower than higher intensity activities would. So you should also keep in mind, though, that with any exercise, you may start to feel some kind of side effects during it, like muscle pain, cramping, weakness, any sort of symptoms of your muscles not having enough fuel to produce those contractions. The next question is, as a result of this deficiency, will she need to get up at night to eat and in order to maintain healthy blood glucose levels? So symptoms of muscle glycogen phosphorylase deficiency can often be managed with simple diet and lifestyle changes, and this includes eating a diet rich in carbohydrates and a little bit lower in proteins. You might find it beneficial to supplement before exercise, like your long walks, with foods and drinks that are higher in sucrose than you normally would. You don't really need to wake up at night in order to maintain your blood glucose levels, but you should make sure that you are eating throughout the day, you're eating full meals throughout the day and some snacks so that your glycogen stores in your liver remain full. So when you go to sleep at night, this will allow your body to maintain those healthy blood glucose levels while you're asleep, while you're at rest, those longer fasting periods. The final question is, does she need to worry about producing excess lactate during intense anaerobic exercise? So with muscle glycogen phosphorylase deficiency. During high-intensity exercise, second wind phenomenon is an issue that you need to be aware of. And this is when somebody suddenly feels like a strong burst of energy a few minutes into exercise after they feel kind of dead, where all of a sudden they feel like they can keep going at high intensities. This can result in some pretty serious issues, such as rhabdomyolysis, which is when your muscles start breaking down in order to keep producing energy, because you've depleted all of your blood glucose. So you don't normally need to be super concerned about excess lactate during anaerobic exercise unless you are really overdoing it and pushing your body too far. The good thing is that in the case of people with muscle glycogen phosphorylase deficiency, lactate uptake often exceeds lactate release in contracting muscle, resulting in a net positive uptake. But this results in subsequent oxidation by active muscles during exercise. So lactate can actually serve as an important source of energy in the absence of blood glucose, because your body can convert that excess lactate into energy while you're exercising. So the second case is a previously healthy 2-month-old female. Was brought in, jittery spells several hours after breastfeeding. Her mother reports that she has never eaten anything other than breast milk since birth and has only recently started sleeping for more than 2 hours, going more than 2 hours between feedings. And that's when these symptoms suddenly appeared. Her lab results show hypoglycemia, but are otherwise normal. And she's given epinephrine and has no increase in blood glucose, but an increase in blood lactate. Her physical exam shows an enlarged liver, and her blood glucose levels do rise after breastfeeding, but she is not able to maintain those normal ranges. So the most likely diagnosis for this patient is glycogen storage disease. Glycogen storage disease type 1 is a hereditary condition, typically diagnosed between 2 and 4 months of age. It's due to a genetic mutation where the baby lacks one of the enzymes responsible for converting glycogen into glucose. Her physical exam confirmed that she has an enlarged liver, which is typical for this condition, because excess glycogen and fat ends up accumulating in the liver and is not able to be released into the blood, causing that enlargement. The mother reports that she has started experiencing jittery spells a few hours after feeding. In some cases, between feedings, patients' hypoglycemia can get so severe, usually less than 60 milligrams per deciliter, that it can result in seizures and other cognitive impairments. Because the baby recently began sleeping longer and going longer between feedings, this would explain this sudden onset of symptoms that she's experiencing. Previously, the baby was likely consuming carbohydrates frequently enough that she was preventing these hypoglycemic episodes. So one way that patients are often tested for glycogen storage disease is called an epinephrine challenge test. This is where a single dose of epinephrine is administered and the patient's blood glucose and blood lactate levels are monitored over time to check their response to it. This child's blood glucose stayed constant, but her blood lactate did increase in response to the epinephrine. In typical healthy patients, epinephrine causes an immediate rise in blood glucose levels. This is because epinephrine accelerates glycogenolysis, which is the conversion of liver glycogen to blood glucose. And this occurs to maintain those blood glucose levels in response to stress. Epinephrine is also known to increase blood lactate levels because skeletal muscle is stimulated and it releases lactate for oxidation or gluconeogenesis. So increased blood lactate is a result of this aerobic glycolysis. So even with glycogen storage disease, patients would experience this similar response to epinephrine. So the best way for them to treat glycogen storage disease is to supplement in order to prevent those hypoglycemic periods. And this can be done through the use of nutrition supplements or usually uncooked cornstarch. That's because the cornstarch is a complex carbohydrate that's difficult to digest. So this will help maintain those glucose levels in a healthy range for longer periods of time than regular food would. So it'll be really important throughout this baby's life that she keep carbohydrate-rich food and snacks accessible at all times, so that she can prevent these hypoglycemic episodes. So unfortunately, there's no treatment other than just managing symptoms and preventing the onset of symptoms.